Welcome to our presentation. Now today our presentation is on kidney disease in Aboriginal and Torres Strait Islander people. The contributors to this presentation are Akriti, I myself Celeste, Abdul, Cheyenne and Kimberly. I myself Celeste will be speaking throughout this presentation. Now all the information that has been put together has all been contributed equally by every one of us in this group. We really hope you enjoy our presentation. Thank you. Before we begin our presentation, I would like to do the acknowledgement. I acknowledge the Australian Aboriginal people as the first citizens of the nation and the traditional custodians of the land where we live, learn and work. I offer respect to the traditional land of the Darug and Tharawal Aboriginal people and pay respect to their elders past, present and emerging. The main aim of this presentation is to link with health literacy and the remote and Aboriginal and Torres Strait communities within Australia, in order to help gain a full understanding of their culture and the selected determinants of health will help gain an understanding on their impact on health. Inadequate healthcare, which is due to transportation difficulties, as discussed further on in the presentation, economic stability, so financial stress, and the lack of education, which is linked highly to health literacy. These all have an impact on the higher possibilities of unfortunately getting kidney disease. And also to throw some light on the appropriate approach to the overall healthcare needs, which this might include how to talk to Aboriginal and Torres Strait Islander health with links to their culture. Also to help remove any biases or any stigma around their culture. Now just a brief description of a remote community. A remote community can be defined by the walking or travelling distance to the nearest capital cities, service centres, workforce centres, medical centres and metropolitan centres. Did you know 25% of Aboriginal people live in remote areas of Australia? Most communities are in the Kimberley and Pilbara regions of Western Australia. Now with the Government of WA Regional Service and Reform Unit, we have the titles of some communities. Now I apologise if I don't say these properly. There's Ardaloon, Bailu, Beagle Bay, Bidyadunga, Darrinjin, Lombardina, Moanjum, Wakathuni, Warramun, Yandiyara. And those are the regions within the Pilbara and Kimberley regions of WA. Unfortunately, Aboriginal people who live in remote areas have a higher mortality rates, and they do increase with the type of remoteness. Though Aboriginal people who live in remote areas have more ownership of their own land. Aboriginal people who live in remote areas or very remote areas unfortunately do have a very higher rate of risky behaviours, which includes smoking, drinking, and poor access to health services than Aboriginal people who live in metropolitan communities. Though there are health services available to them, which is fly-in and fly-out community services, so a health clinic that comes to them, and a company in particular is Angel Flights, 24-hour health service call line, and a Ronald McDonald community housing when needed outside of community due to healthcare needs. So there are options available for them to help them adequately address their healthcare problems. Okay, now we're on to health literacy. So health literacy describes the ability of a person to understand essential health information that is required for them to successfully make use of all elements of their health system, which includes preventative, diagnostic, curative, and palliative services. Health literacy lies at the heart of a person being able to take control of their own health care through making informed health decisions, seeking appropriate and timely care, and managing the process of illness and wellness. And this quote was sourced by the Department of Health. The importance of health literacy: it helps shape people's health and the safety and the quality of their own healthcare. Low levels of individual health literacy contribute to poorer health outcomes, increased risk of an adverse event, higher healthcare cost. And this one has come from Australian Commission on Safety and Quality in Healthcare. With Aboriginal population, especially in the remote areas, health literacy is kind of due to the communication gap between health professional and the Aboriginal people, and it does have a significant impact on their overall health. But there is ways to help combat that and help aid in their own health. In Australia, it is estimated that less than 60% in Australia have low health literacy. So therefore, our option is to help close the gap so their healthcare need becomes a lot more accessible to them, and the education helps them a lot more towards their overall well-being. So now this is just a brief explanation and description of kidney disease. Here we have some facts. Kidney disease is identified as a level of reduced kidney function or the damage. Aboriginal and Torres Strait Islander people are more likely to be diagnosed with end-stage kidney disease, or ESKD, and therefore they end up being hospitalised or unfortunately succumb to the illness. CKD is usually associated with inflammation or infection, which leads to kidney malfunctioning or low weight at birth, and some morbidities like diabetes, hypertension, excessive tobacco smoking, unfortunately bad dietary habits which lead to obesity, and much more. On this slide we also have a graph. So therefore you can see the remote and the very remote of the graph, and it is significantly higher than major cities, inner regional or outer regional. And there is quite a difference between the male and the females per population. So now we are on to the slide with a few facts on kidney disease in remote Aboriginal and Torres Strait Islander communities. So a fact, Aboriginal and Torres Strait Islanders are likely to be diagnosed with chronic kidney disease at twice the rate compared to other cultures who live in very remote areas of Australia. These are sometimes due, or most of the times due, of high risk factors such as diabetes, high blood pressure, and this is a product of an unhealthy lifestyle, which includes smoking, excessive alcohol abuse, and the use of illicit drugs. Unfortunately, this is according to their poor living condition, which therefore establishes a higher rate of poverty and unemployment. So those who are diagnosed with ESKD, they need to be in a health facility, because some might require dialysis at 3 to 5 times a week in order to stay alive. And this is also partnershiped with clinical assessment reviews. But it does pose a difficult task for most of them, because the health facilities are more located within populated areas, so their travelling is increased. With their travelling increased, as discussed in the overview, some may have to travel 7 hours just to the nearest facility for dialysis. And with this lack of health access poses an emotional turmoil with them and their families, which can lead to self-isolation and financial disadvantages. Early detection and management of CKD. The lack of awareness about CKD and its associated risk factors and preventative measures is a major concern in Aboriginal and Torres Strait Islander people. About 9 out of 10 Aboriginal people do not know the signs of CKD and its multiple risk factors. Linking to the social determinants of health, there is a lack of transplant facilities and other treatment availability in the remote areas. This is also linked to transportation and education. Education, meaning education on health factors that poses them at a higher risk of getting kidney disease. 78% of Aboriginal and Torres Strait Islander people suffering from ESKD have to relocate to access treatment. This poses as a high risk for their health and well-being due to psychological impact. So to be away from their community and their families poses as a higher risk of developing depression and anxiety, because culture is a very important part of their life. Primary healthcare sector, along with adequately resourced preventative programs, can help to minimise the progression of CKD, especially ESKD. So to follow on from the previous slide of early detection and management and the discussion on being apart from their family, Aboriginal and Torres Strait Islander cultures and beliefs impacting on their health. So, culture to the Aboriginal communities is diverse depending on where the communities are. They vary according to geographical location, environment, and resources. And I have a quote here which means a lot to what I am about to discuss within their beliefs. When we are together, we are happy. This quote is by Geraldine Briggs in The Wailing. Rintoul, 1993. Aboriginal culture and Torres Strait Islander culture are very similar because they focus on family. Their sense of family and community doesn't necessarily mean blood. It means who are around them, friends, relatives. Their sense of community lies with each other. So therefore it impacts on their health when unfortunately they have to travel away from their communities. There's a little bit of information on what they believe. Aboriginal culture believes in the land. So dreaming. Landscape where people in spirit form created by the ancestors. The land is their spirits. What they eat from the land is a gift. The dreaming is not only the stars, it is the creation, the cosmography, and their moral system. Torres Strait Islander culture believes heaven is not above them, but the belief is that heaven lies on Kibu, an island where at sundown their spirits sail to the island on little sailing boats, and their personal and cultural identity is dependent on the sea, or home seas. Their communities are generally associated with the sea, whereas Aboriginal communities in remote areas tend to go inwards to the land, so to be closer to the soil. So now we're on to social determinants of health. Now, determinants of health, described by the World Health Organization, is the health factors that contribute to a person's current state of health. These factors may be biological, socioeconomic, psychosocial, behavioural, or just social in nature. Now, the main determinants that we'll be talking about today, which has a very high impact on the overall health and well-being of Aboriginal and Torres Strait Islander communities, are healthcare services. Healthcare services is not very readily available to them, for some having to travel hours to the nearest healthcare service. Now, as I said in slide before, there are available fly in and fly out services or a 24-hour call line. But unfortunately, needing dialysis for CKD, travelling is one of the main points. Housing and unemployment is also poses a very high factor. With housing and unemployment, there is no financial stability, so therefore poor life choices are put in place, which is poor nutrition, less physical activity, increased body weight, excessive drug and alcohol abuse, excessive tobacco use, and these factors all contribute to be diagnosed with CKD. Now, with the high amount of drug and alcohol abuse, there is unfortunately a significant factor of family violence. So, healthcare services are a very big factor into helping reduce these problems. Now, to discuss why the social determinants of health is important, especially with Aboriginal and Torres Strait Islander remote communities, is the WHO is trying to reach a health equity. Health equity is when everyone has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of their social position or other socially determined circumstance. Now, this is a main point, and this is what everyone has to strive to achieve, is to help and close the gap in Aboriginal and Torres Strait Islanders' healthcare. Culturally competent and safe nursing and midwifery practice within the Aboriginal and Torres Strait Islander communities. So, with referencing back to health literacy, unfortunately it does pose a barrier in order for them to provide proper healthcare needs for themselves on our topic, chronic kidney disease. Now, as a nurse, there is a cultural competence that we have to follow, but also in general, it's important to provide a safety net to help them access their healthcare needs without any worry. So social cultural competence is being aware of the cultural differences that do exist, appreciating having an understanding of those differences, and then accepting them. Prepared to guard against accepting your own behaviours, beliefs, and actions as the norm. So in full understanding, don't be biased, and don't have any bias towards Aboriginal and Torres Strait Islander communities while addressing their healthcare needs. Cultural safety. This involves actions that recognise, respect, and nurture the unique cultural identity of a person. This safely meets the needs, expectations, and rights of a person. This means working from the cultural perspective of other person, not from your own perspective. So, as discussed, to provide a safety net and a welcoming attitude, so therefore they don't feel upset towards the healthcare problems. Us as nurses have to provide protection and help have an understanding on their own cultural beliefs. So therefore, there is some cultural beliefs that we have to abide by. So in order to discuss with them further, there is few implications that have to be put into place. There is an appropriate verbal and non-verbal communication, but also you can refer patients to the Aboriginal Liaison Officer for the extra support with the healthcare facility. Also, be mindful of eye contact. Some Aboriginal and Torres Strait Islander people will find eye contact offensive or disrespectful. So, overall, there's a few communications that we have to educate ourselves and put into place to gain trust. Also, we can be aware and help interact ourselves to the communities and help build our own personal education towards different cultures and beliefs in order to overall help gain trust, help gain peace and understanding on both sides with the influence of culture and education towards healthcare needs and overall well-being. Next is Code of Conduct for nurses. Now these Code of Conducts that we do have to follow by is focusing on Aboriginal and or Torres Strait Islander people's health. So, we provide care that is holistic, free of bias and racism, challenges belief based upon assumption, and is culturally safe and respectful for Aboriginal and or Torres Strait Islander people. Advocate for and act to facilitate access to quality and culturally safe health services for Aboriginal and Torres Strait Islander people. And recognise the importance. So, this is a vital thing to help gain trust and help gain an education understanding for us nurses. So now we have reached our last slide, the conclusion or the summary of the main points that we have discussed in this presentation. So the main point is the Torres Strait and Islander health related to kidney disease. Now their risk is higher than any other Australians and is also increased with remoteness. And this also is linked to the social determinants of health with healthcare services, which are unfortunately not readily available to them. This also impacts with health literacy and their understanding of healthcare and their own personal well-being. So we have discussed as a group to improve regional and remote Aboriginal and Torres Strait Islander patient kidney care. Nurses in one hand need to have adequate cultural knowledge and awareness about the patient's culture. On the other hand, nurses should be professionally capable to involve or empower the patient to be as an effective party in the process of healthcare. This can be managed by pairing between clinical and cultural knowledge as an alternative option of healthcare to ensure the patient's safety and to help the patient to achieve their better health outcomes. So this also is education on both sides. Education for the nurse to educate oneself on different types of culture, especially Aboriginal and Torres Strait Islander culture, to help adequately gain their trust and gain an understanding on how to talk. Also, to understand the different barriers that can pose as risks, but there's always options out there to help them strive for their optimal well-being. Thank you, and I hope you have enjoyed our presentation, and I hope this gives a large insight on kidney disease related illness within the Aboriginal and Torres Strait Islander community. Thank you.